Good evening everyone. Today I can talk about resorption of permanent teeth. Resorption of permanent teeth is always pathological. Pressure is probably the main factor. Let's talk about important causes of resorption of permanent teeth. Periapical periodontitis, the most common cause, but it is usually slight. Impacted teeth pressuring on the root of adjacent tooth. Unerupted teeth. During the course of years, this may undergo resorption or hypercementosis or both. Replacement teeth. These are sometimes rapidly and grossly resolved. Pressure from cyst and neoplasm. Idiopathic internal or external. Okay, here we will go internal resorption. It is an uncommon condition in which dentin is resolved from within the pulp. Resorption tends to be localized, producing the sign of characteristic of well-defined rounded area of the radiolucent C in the crown. This may affect an incisor teeth, pink, where the vascular pulp has become visible. This cause is unknown, but it may possibly be a late result of damage to the blood supply of the pulp by a blow. External resorption may be localized or generalized. Very rarely resorption may start for unknown region on the surface of the root near the apex and apoptotic. Over the course of the years, more than half of the root may destroy. The lost tissue is partially repaired by bone-like tissue. Localized root resorption is also uncommon and of unknown cause. A limited area of the root is attacked from its external surface, and resorption goes on until the pulp is reached. Okay, now let's talk about what is bruxism. It is forceful grinding of the tooth. Effects of bruxism: noise during grinding, attrition and occasionally sensitive, fracture of cups and restoration, increased mobility of teeth, hypertrophy of masseter and anterior temporalism muscle, sometimes tenderness on palpation and limitation of jaw movement. Bruxism is divided into two times. In nighttime, the teeth are cleansed. Bruxism is often performed in a protrusive or lateral excursion, so that the forces are borne on a few teeth and in an unfavorable direction. The resulting attrition can be deeply destructive, particularly in a class 2 malocclusion. Attrition may also be in elderly, particularly as a result of physiological wear. Daytime bruxism is seen more frequently in females. Bruxism has been linked to a number of medical conditions. It is common in learning disability, Down syndrome, cerebral palsy, Parkinson's disease, and autism. Let's go.